Good afternoon or morning, depending where you happen to be. I'm Kee Powell, Senior Policy Director at Benefits Data Trust, and we're really excited to have those of you who are here today join us to talk about this new opportunity that BDT is going to engage in regards to SNAP telephonic signatures. Next slide. So today we're going to just do some brief introductions. Like I mentioned, we're going to do a short history of telephonic signatures to provide some context to the overall project and what it is that we're interested in accomplishing. Overview the project itself, talk about the application to apply for states that may be interested, and then we will end our time today with an opportunity for states to ask questions and us to provide some answers. So next slide. So if you're not familiar with Benefits Data Trust is a national nonprofit. We actually started out about 20 years ago as a SNAP outreach vendor in a single state, and over time grew in that capacity and have at this point served 9 different states as a SNAP outreach vendor over the years. We remain a SNAP outreach vendor in 6 states. And BDT's method of providing SNAP outreach has really been through 2 types of efforts. One is using data sharing through looking at Medicaid enrollees and seeing those enrollees that are not enrolled in SNAP and directly outreaching to those enrollees. Through that outreach, we actually provide application assistance, and depending on the state's capacity can actually help submit most portions of the application. Because BDT has operated in 9 different states in total, but 6 different states still today, we have used telephonic signature from the beginning and still use that today. We can go to the next slide. With our telephonic signature efforts, we really see telephonic signature as a critical mechanism for states to use in order to support not only SNAP outreach, which is originally how BDT supported states, but also on a much larger scale by using telesignatures at the state level or with CBOs to be able to support clients applying in the most efficient and dignified manner. BDT has dedicated to streamlining benefits access, not only through our SNAP outreach efforts, but over time have expanded to work in both the outreach space, the technological space, and in the policy space. So part of the efforts here today are to help learn more about telephonic signature, implement telephonic signature in states or improve it where states might already have it, but also to inform policies that would help telephonic signature work more productively in all states. BDT, as I mentioned, which is dedicated to streamlining benefits access, has cornerstones of the work that we do, including that our efforts are proactive, that we help people at many entry points, that we try to be the most cost-effective and modernized when we're supporting different efforts at a state level. But a cornerstone of our work is also being dignified. And we believe here that using telephonic signature and eliminating wet signatures where one can really enhances the client experience. Next slide. So I'm going to turn it over to my colleagues here today, Lucas Caldwell-McMillan and Jillian Humphreys, as they are the ones leading this cohort effort. And they're going to talk a little bit about, first, like I mentioned, the history of telephonic signatures, but then also the cohort itself.
Hey everyone, I am Jillian Humphreys. I'm a policy manager here at BDT. So first, next slide, please. We're going to give a little bit of history. With BDT's experience with SNAP telephonic signatures, as Kee had mentioned, we currently work in 6 states that we partner with for SNAP applications. So we have experience since the beginning of BDT. We've been using SNAP telephonic signatures since 2010. BDT submits over 500 benefit applications each day using telephonic signatures using the audio recording option. And as I said, we do this in 6 states. So that we have a lot of experience with the a traditional audio version of the telephonic signature. Next slide, please. So this is the history of SNAP telephonic signatures in general. In 2008, the Farm Bill introduced state options to implement telephonic signatures by audio recording. That's what many of you traditionally know as capturing the client's attestation through an audio recording and keeping that in the case file. In 2014, FNS guidance included how states can partner with third parties, such as BDT, in getting this. And in 2020, there was a temporary COVID waiver to implement telephonic signatures by case notes. That's where you just indicate in the case file that the client confirms that they are applying for SNAP benefits. Well, in 2022, as the PHE was unwinding, FNS introduced the renewable waiver to implement telephonic signatures by case notes. So we're going to talk a little bit about all of those options moving forward. Next slide, please. So why should your state adopt or improve your telephonic signature processes? Well, as Kei mentioned earlier, it eliminates the need for wet signature. So this makes the process easier for both the administrative process as well as the process for the clients. It improves the processes for families, administrators, the ability for community partners to provide application assistance, and just overall creates a more efficient application process and opportunities for coordinated renewals with Medicaid as well. So it benefits it benefits both sides of the program, SNAP and Medicaid. Next slide, please. So we're going to talk a little bit about the telephonic signature cohort that we're all here to talk about right now. So if you can go to the next slide, the telephonic signature cohort that we are currently in the application process for if you are part of that process, it will include monthly group technical assistance and peer learning. So every month, the states that are included in the cohort will participate in monthly calls where we will talk about the current processes, where everyone is, questions, and share learnings across the states. Quarterly, there will be one-on-one sessions that are tailored to the individual state's needs. So each state that is part of the cohort will get a quarterly one-on-one call with BDT to individually talk about where they are and how we're going to meet their goals that we came up with at the beginning of the implementation process. Also, individually tailored telephonic signature solutions. So we're going to talk a little bit more about what that looks like, but after we do an assessment and see where your state is and what your needs are, we'll be able to help you figure out how to move forward. There's also an optional on-site visit by BDT staff one time during the cohort process. So we are offering our staff to come on site and meet in person with you for a day and go through all of the things that we've been talking about throughout the cohort and wrap up anything that we may need to do with you guys. And then finally, we will evaluate the effectiveness of the solutions implemented, which is a really important piece of that because there has not been a lot of research around telephonic signature and how it may or may not improve the processes for states, for clients, for everyone involved. So we would really like to evaluate how that solution was implemented and what the effectiveness was of it. Another thing we would like to do is, because of our conversations we've had with states who already are doing telephonic signature and feel like they are doing it well, we'd like to bring in some states to share some of their learning. So even states that aren't a part of the cohort may participate in some of these conversations just so they can share what they've learned and how their states have done it. If you could move to the next slide, please. So after implementation, the activities that will take place are: one, we will disseminate the learnings from the cohort to states and partners. We are going to help states create pathways to share SNAP data with Medicaid. So again, streamlining access to SNAP will also help streamline access to Medicaid. And then finally, we'll share our learnings with USDA so that we can share everything that we learned from the states that participated in this cohort. Next slide, please. So state participation, we are going to be recruiting 5 to 8 states to participate in this cohort. Again, these states are going to be able to work with each other, talk with each other on monthly calls, learn from each other. BDT has extensive experience with providing technical experience with states, and we also have experience leading these cohorts, which has been really beneficial to states in learning from each other. Next slide, please. So in addition to all of the activities that are included in the cohort. The important piece for you guys to know is that there is no cost for states to participate in this cohort, and there is funding for agencies to help offset the administrative cost of participation. So we're not charging you anything to participate, and we also have some funding to provide to states depending on their needs and what we have available to be able to help offset some of the costs. Examples of how that funding may be used could include change management, system updates that are required based on needs we've determined, or expenses associated with core team participation, because we know that it's going to take time to have a group of people that have to be involved in this process. So the funding is expected to help with that. The amount of funding is going to vary depending on, of course, how many states end up getting to be a part of the cohort, what individual needs are, and we will determine that after we do an assessment of the states that are included, and then we can determine how much funding we can provide to each state depending on their needs. Next slide, please. So benefits of agency participation, we've hit on this a little bit, but this is what your state can expect if you are included in the cohort. First, an assessment of your current processes, then individually tailored telephonic signature solutions based on the assessment that we've done, funding to help offset administrative costs. You will receive assistance from BDT with writing your waivers and requesting waivers and submissions. So if you need help with that, if you haven't done that already, we can help you write those waiver requests and submit them. You can expect to see more efficient application processes based on implementing telephonic signature or improving the processes that you maybe already have in place. Streamlined access to SNAP, which in turn becomes streamlined access to Medicaid. Shared learnings across multiple states, all the states that are included in the cohort, as well as any other states that may have some good advice to provide to us. Post-implementation evaluation, and then of course having a voice for your state agency. So if you're part of this cohort and you know that we're going to be sharing learnings throughout the cohort and especially disseminating lessons learned after the cohort, then it would be really important to have your state agency heard and be able to share that information. Next slide. So we have talked about what the cohort is, what telephonic signature is. We're going to talk more, I'm going to turn it over to Lucas in just a second, and we're going to talk more about the application itself, and then we're going to get into questions and answers afterwards. Lucas, go ahead.
Great. Thanks, Jillian. Hi, everyone. My name is Lucas Caldwell-McMillan. I'm Associate Director of Policy at BDT. As Jillian said, I'm going to go over the application process and also share the actual application with you all. And I encourage, if you have questions about the application process or the application itself, please use the Q&A function in Zoom. We will be, after my section, turning to the Q&A section. So use that box to ask any questions you have, including questions about the application. First, a few key dates. Reminders that the application, which is live now, is due November 17th. And we're going to notify agencies that are picked to participate in the cohort by November 28th. And we slated the cohort to start January 2024 for approximately 10 months. Next slide, please. So who should apply? Well, we've really designed this cohort to offer a diverse selection and be designed to bring together a diverse group of states to join the cohort and learn from each other. And so it may be that your state has never implemented telephonic signatures for SNAP before. Those types of states should absolutely join the cohort. But maybe that your state has adopted telephonic signatures and you're looking to improve the processes or improve how you use telephonic signatures for SNAP. For example, maybe despite having telephonic signatures, maybe under some circumstances, you still require a wet signature or mailing or returning a physical signature from your beneficiaries. And you want to see how you can improve that or reduce that further. Or maybe the telephonic signature process for your staff in reviewing the application and going through rights and responsibilities is taking a lot of time. And you're interested to see how you can still comply with the requirements of the SNAP program, but streamline how those telephonic signatures are collected over the phone. we would encourage those states to apply as well. We really think the benefit, as Jillian mentioned, and us, as we've led Cohort, is really states learning from each other. And so we know that there may be one state that's faced a certain barrier, and they can help through another state, or maybe help a few of the states in the cohort. So really, any agency that feels that they may benefit from participation in this cohort, we'd encourage them to apply. And I'll walk through that application in a moment. One note for those of you on the webinar who are not SNAP agency staff. Happy to have you. Glad you're here. Glad you have interest in telephonic signatures. We do need the application to be from the SNAP agency. So here's what I recommend you do. At the end of the webinar, you're going to get an email with the recording of the webinar and a link to the application. Please forward that to your SNAP agency colleagues, contacts you have at the SNAP agency. And I really encourage you to add a little note about why you think your state or your SNAP agency could benefit from improving or adopting telephonic signatures. So send those on and encourage them to apply. The deadline's November 17th, and they can apply today. So even if you're not from a SNAP agency, thanks for joining us, and we really do encourage you to reach out to your SNAP agency contacts so that they can apply. Next slide. So now I'm going to walk through the application. In designing the application, we really did try to design it so that it was not a burden on SNAP agencies. So you'll see that it is a 15-question SNAP application, and we think it can be completed in under 20 minutes. The first part of the application is just the background information that we went over today. I'll highlight again that applications are due November 17th, and it's available now. And my colleague will be sharing the link to the application. You'll get it in an email, and they'll be sharing it in the chat as well. So after the background info about the participation, we get to the first set of 15 questions. And that's where I say I really, 15 questions is an exaggeration of what will require you to complete the application, because these are really just background for the individual completing the application, their name, phone number, email address. And then the next section of questions, starting with question 7, is background on the SNAP agency and their use of telephonic signatures. So I will say for question 7, I want to point out that to make this as easy as possible for you all, we did make many of these questions multiple choice. But in question 7 in particular, we did add another box. And so I know that SNAP is a very complicated area, and SNAP agencies have complicated setups. And so if some of the categories that we chose for what is your current status with SNAP telephonic signatures doesn't apply to your SNAP agency, please use other and give us a more complete answer about where you are on your SNAP telephonic signature journey and implementation. Scrolling further down, the next set of questions is a little bit more background, like are SNAP and Medicaid within the state agency in your state? And then I'll point out the last background question, which is question 13, which is how do you plan to use SNAP telephonic signatures? Here again, I'd encourage you to use the other box. We listed here what we think are the most common uses of SNAP telephonic signatures. But the beauty of the cohort is, believe me, if you've got an innovative way you're using SNAP telephonic signatures that we're not aware of, that's going to be the first things, if you're selected to join the cohort, we ask you to share with your colleagues at other states, which is, okay, how are you using SNAP telephonic signatures? Can you share that innovative way? So please select all that apply, but also if you do have another way you're using SNAP telephonic signatures, I would encourage you to fill out the other and share that information with us. The last 2 questions on the application are our only short answer questions. And these really get to, in question 14, what's the benefit? How do you see your SNAP program improving by using SNAP telephonic signatures or making them more efficient and improved? Here, I'd encourage you to consider both the impact on staff. So maybe it's going to become more efficient, and so staff will save time. Maybe it'll help streamline a process for staff or answer some confusion for staff around SNAP applications and SNAP eligibility processing. But also consider the impact on the beneficiary. how will it improve access in your state? How is it going to improve the customer service experience for those applying for SNAP or for SNAP beneficiaries renewing or interacting with your SNAP agency? So we want these to be short answer, under 250 words. I want to encourage you to let us know how you think this can improve your SNAP program. Question 15 gets at barriers. Here to go back to Jillian's talk about how we're going to construct our technical assistance sessions, we're really looking to identify what are some common barriers for our cohort. So if there are 4 or 5 or 6 states that all identify the same barrier, we know that's a good topic for a group technical assistance session. And on the flip side, if just 1 or 2 folks identify the barrier, then we know maybe that's better served for a one-on-one technical assistance session. So please, be complete in describing what you think are the barriers to implementing efficient telephonic signatures. And as an example, maybe a quite obvious example, if you're planning to maybe transition to a new SNAP eligibility MIS system in early 2024, that would be potentially a barrier. And so we just like to know those sorts of information and any other barriers that you think you might encounter or have already encountered in using SNAP telephonic signatures in your state. So that's it. That's the 15-question application. We think you can complete it in under 20 minutes. And you click submit. It will go to our team. You can print off a copy of your answers if you want to have those after you click submit. And as I mentioned, we'll be informing states by November 28th if they've been selected to join the cohort. Okay, with that, we're going to start the Q&A portion of the webinar. And also, before we jump into that, we do have a quick Zoom question poll for participants, just so that we can learn a little bit about the states that have joined today. So please take a few moments to answer that one question. If you haven't already, if you've got a question that's come up, please use the Q&A section. And I'll pause to let you fill out that poll, and then we'll begin the Q&A. Yeah, great. So it looks like we do have a good cross-section of states as we expected. So I'm glad to hear that. And I'm glad to see we've got a good section of people who have, looks like 65%, which do not regularly use telephonic signatures for SNAP. But some states that are already implementing it or have begun to implement it, being the sort of the remaining. And although you couldn't answer other in the poll and fill in your exact specific circumstances, if you do apply, I look forward to hearing those twists on where you're at with SNAP telephonic signature, again, knowing that this is such a complex area. So thanks for participating in that poll. I'll remind you again that if you have questions, add them to the Q&A. A few have already come in. So I'll start, Jillian, with you for the first question, which was, how can SNAP telephonic signatures be leveraged to support immigrants and those with limited English proficiency?
Yeah, thank you, Lucas. So that's a great question. First, SNAP telephonic signatures streamline access to apply for SNAP by phone. SNAP agencies who allow multiple methods of application are more likely to meet the needs of all of their beneficiaries, including immigrant families and LEP households. Second, telephonic signatures can be used by third parties. So in states that implement telesig with local community-based organizations, states should include community organizations based in immigrant communities among those CBOs that are equipped to use telesig. So that answers the question for how it can be used to support immigrants and those with LEP.
Great, thanks. Now we have a couple of more application-related questions. The first is there a cap on how many states can participate this year?
Yeah, so as part of this cohort, we have a limited amount of funding available with this grant that we received. So we are expecting to include 5 to 8 states. That's just based on our experience with similar cohorts on what works. Once we determine which states will be involved, there will not be, at least at this time, there will not be another round, so to speak. We're going to do these states, and that will be it for us. But we expect 5 to 8. We figure that's a good number based on our experience with other cohorts.
We've got a couple more questions. If you have not yet answered it into the Q&A function, please add your question to the Zoom box. Next question, which is, again, just shows the nature of the complex area of SNAP. The question is, for states that are county administered, and we do ask in the application, would the state agency be the one filling out the application?
So yes, for county administered states, we need the state to fill out the application. If you are a county that feels like your state could really benefit from telephonic signature, we encourage you to work with your state administrators on making this happen. We would be open to maybe doing like a county pilot option when states implement telephonic signature, but because the states are the ones that have to request the waiver, the states are the ones that need to do the application. So if this is something that you think your state should do, I strongly encourage you to talk to your administrators and get them on board with that.
Thanks, Jillian. I know another question that came in previously was about the audio recording option. And Key, maybe this is a good one for you. And the question was, how difficult is it and how much time and burden is it to store and record audio recordings if that's how you're doing SNAP telephonic signatures?
Yeah, great question. So prior to coming to BDT, I was at the Colorado Department of Human Services at the state, and we had implemented the voice recording option of telephonic signature. I will say that for many of you, you know that adding or modifying your data systems at the state does often require a long runway. Because you have to figure out when that build can go in up along all the other priorities or regulations that you're putting into the system. So that was one thing that it did take us a longer amount of time to do that, but it also was something that we had to have funding for because obviously when you're putting in these builds into your data system, you always have to have extra funding to be able to figure that out. So it was something that, again, I still think any version of telephonic signature is a good thing to have, but the audio recording version does require not only the technological build, but then also buying space, and I am no technologist, in the cloud, as they say, to be able to store those voice recordings over time.
Thanks, Key. We have another county administered question, which asked, does BDT have experience working in county administered states? I don't know who wants to take that one. I see some nods. Who wants to jump in on that one?
It's just pointing to me. So actually, yes, a significant amount of experience working in county administered states. We, as I mentioned earlier, we still operate 6 as a SNAP outreach partner in 6 states, 3 of which, if I'm doing my math right, are county administered. But even some of the prior ones that I said earlier, like we've operated in 9 states over the course of 20 years. And then not only I talked about how we've our SNAP outreach partner, but how we've expanded our purview over time, providing both technological solutions as well as policy solutions. So in our work in some of the policy area, we have also worked with county administered states in more of a like boots on the ground technical assistance, implementing policies that make significant changes to streamline benefits. So in those examples, so for instance, currently we're rounding out a 6-state effort where we've been working on Medicaid churn, reducing Medicaid churn in relation to the unwinding. We had a number of county administered states in that as well. So we have extensive experience working in county administered states.
I also just want to add to that Key came from Colorado, I came from North Carolina, so we both personally have experience on what it looks like on the ground and how what it can look like and how differently county administered states look compared to state administered states. So we're both very familiar with how unique that is compared to a lot of other states.
Our next question, Jillian, is about the funding and asks, do the selected states receive funding to support their participation in the cohort?
Yes, the selected states, all of these selected states will receive funding to support their participation. The amount will depend on two main factors. One, how many states we end up including. So we have a certain pot of money that's available. So obviously, if we have 5 states versus 8 states, that affects the amount of money that's available to the state. The other piece that we're going to be looking at is what the individual states' needs are. So if one state needs to do system upgrades and one state needs to do change management, that's going to look different in what kind of funding is available for them.
Thanks. It looks like we have one question left. So this is both a warning to my fellow panelists, but also to participants. If you haven't gotten your question answered, please add it in now. And we're getting a few now, so please keep asking the questions. And feel free, if you know your state wants to participate, like I said, the application's live. So this question doesn't apply to you. There's nothing stopping you from filling out that application as I talk. This, Jillian, I think is for you, just a little bit more background about the Telesig waiver. What does that allow states to do? How does it avoid using an individual to submit what I call a wet signature, but a physical signature, one they're signing on a piece of paper and then submitting it to a state?
Yeah, so this is very similar to the option that was available during the COVID PHE, which is that the waiver option allows you to notate in the case file, client has applied for SNAP and confirms that all of the information is correct and true. So instead of having to mail the application to the client and having them sign it and send it back, you would just notate the case file and that would be the end of it. It is very similar to the previous telephonic signature option, with the exception of needing the technological pieces where you would do an audio recording. Instead, you would notate in the case file.
And we have a related question about that waiver, Jillian, that goes back to your history of SNAP. And so a question about whether that waiver is a permanent waiver or just temporary, similar to COVID, the waiver that you just mentioned that allows those case note recording waivers. So could you address that?
Yes, so at this time, it is a permanent waiver, but it does have to be renewed from our understanding every 12 months. So that is the current situation with this waiver. So you would apply for it, but then you would have to renew it every 12 months afterwards at this time.
Okay. And the last question we have is the funding 1 year or multiple years?
Yeah, the funding would be one time. So while this cohort is going on, again, it's going to be, we expect to begin in January, and then it could be 6 to 10 months, depending on what the individual state's needs are. So you would get funding one time, and that would be it. And it's mainly to participate in this cohort. So if there are needs that you have, and you feel like there's going to be additional funding that you'll need later on, then that's something you'll want to talk to your states about. But for this cohort, we have one-time funding available.
All right, I'll pause for a second and see if there are any other questions, but I think that completes our info session today, and really appreciate you all joining us today, and encourage you to consider joining the cohort, or again, if you're not a member of SNAP agency, encouraging your SNAP agency to join the cohort. And I'll turn it over to Jillian to finish it out.
Yeah, so I'm going to include a link here in the chat, which will give you more information about this cohort. So if you go to that link, it will tell you all about this project that we have going on, and there's also a link to the application. If you have any questions, feel free to email me. My email is here, jhumphreys@bdtrust.org. And we also encourage you to sign up for the BDT newsletter, which you can do utilizing the QR code here on your screen. We look forward to seeing the applications come in. Again, like Lucas said earlier, if you are not a state agency, feel free to encourage your partners at the state level to apply and inform them of what you've learned today.